Welcome back to the Pause and Effect podcast. I'm your host, Dr. Cara. In the final part of our holiday safety series, we're unpacking why accidents and trauma cases spike during the festive season. From car accidents and wildlife encounters here in KZN to injuries during family gatherings anywhere in the world, there are clear patterns every vet sees at this time of year. By the end of this episode, you'll know how to reduce your pet's risks and when to get emergency help straight away.
Puncture wounds, they can actually sometimes be quite devastating. The iceberg effect, so you can see this little hole, but underneath it's absolutely shredded. So I do think you can get this big massive pocket where you're going to get this huge either blood or tissue fluid accumulation, which is just a little petri dish waiting for an abscess or an infection to get set into.
I mean, the greatest example is when we have a cat bite abscess. You know, I think people don't appreciate they have a lot of bacteria in their mouths.
And people think, that's nothing. And then the next thing, a couple of days later, you've got this big massive swelling, which is then an abscess forming. So then sometimes it might rupture, which is fine because then all of that muck comes out. But then the clients don't still then bring them in because now, it's ruptured, it'll be fine. That skin closes over again and you get that little nidus of infection and you get exactly the same thing happening again. So it is always advisable to get it flushed out, lanced and drained.
Welcome back, Dr. Nic Stirk from Watercress Vets.
Thank you very much.
We've done part 1, we've done part 2, and this is part 3, where we're going to be talking about accidents and traumatic events during this festive holiday season. It actually becomes quite crazy. Is it because there's a massive influx of visitors into our area? What explain some of the logic behind why we get
shame.
this?
I think it's also people are visiting more when it's school holidays, particularly as well. So we're in school holidays now, but then of course then we get a much longer school summer holiday. So people are in and out. People are busy trying to get everything ready then for the festive season. So maybe not concentrating as much on, is that gate closed? Is the garage door closed? Is the entrance to the property closed? How traffic savvy are your dogs? Like, there's nothing worse when I do house calls and going in and then you actually have to stop the car. Because then you have all the dogs running around the car and people are like, your dog, they're fine, they'll get out the way. And I was like, can you imagine the headlines? Vet runs over dog at house call. So I think also that's an important thing it is a tricky thing to try and train, but just to also then just make sure if you know that your dog isn't going to be street savvy when cars are arriving on your property or anything else like that, rather just put them in a different part of the garden or keep them indoors until all the cars are stationary, because it can happen. It happens just like that, and the person who actually does the impact will always feel the worst. I mean, it's terrible, and it can be the softest little bump, and it can have devastating injuries. It can be a full on gudoof, and there's nothing wrong. So, but it is so important to get them checked out. So something that's not immediately apparent can start to manifest a couple of days, weeks later. Yeah, that's it.
Or a diaphragmatic hernia. I mean, I can't even begin to tell you. Like, people are like, there was an incident, it was 2 weeks ago, and they're sitting with all the contents of the abdomen in the chest. How they've coped for that period of time. Hey? So one of the things I was thinking about when you were explaining, dogs running around the car and the gates and the visitors and people not concentrating is, of course, this time of year, we get an increase in the number of storms. We get fireworks. And that's often, do you not find post those events, whether it's been a terrible loud thunderstorm or there's been fireworks, that you get a lot of traumatic injuries because pets get out of the gates?
Yeah. So we're now in October. So I actually looked it up today, funny enough, because I saw one of the companies, they do the calming medication. So they're offering they're just basically reminding everyone that their product is available because now we're getting Diwali on the 20th of October. So, of course, that's the Festival of Lights where fireworks have been incorporated into that now. It's frightful what these poor animals have to go through. So not only the domestic pets, but the wildlife as well. But yes, it doesn't take much to, especially if a dog is particularly sensitive to thunderstorms even. I mean, they can detect those storms coming kilometers away before we can detect them that they're even on their way.
Yeah.
So certainly loud bangs, the fireworks, can certainly send pets into a frenzy, and they will try anything to try and get away from that noise onto the streets.
Jumping through glass. We've seen
horrible,
that.
Horrible. You're literally chewing themselves out of a room, out of a crate, because they are just so anxious and worked up. So yeah, that's certainly that's a major one. Also, I think the age of the pet has to do with it. So if you have this 10, 11-year-old Labrador that's got bad hips or whatever, everything else, they can't get out of the way like they used to be able to when they were younger. So, or they're deaf.
No, they're deaf. I was going to say. They can't hear. We've had ones where they're like, they don't even know.
So they don't even know that the car's coming, and you can't see them because now on the ground you can't see them in your side or your rear view mirror. And so it can happen, like I say, just like that. It's not necessarily anybody's fault. Accidents happen. The important thing is what you do then afterwards.
And to try and just be aware, and if we can avoid some of these things. I mean, you were saying older, but also the young. They're just not savvy. You know, they gangly and they're busy playing, or they don't get it.
They're all excited. There's a new, and dogs know the sound of those engines. They know different engines as to who's coming in and stuff. So, this is a different sounding engine. Must be new friends. And then they'll go out and run around, and especially that running around the car, makes my blood run cold.
Oh, no, I'm with you. So one of the main things I see, or I have been seeing, are the fight wounds. Introduction of new pets, visitors, family members wanting to bring their pets onto the same property. What are some of the ways that we can actually avoid these kind of incidents? How do you generally recommend if people say, look, family's coming for Christmas, they want to bring the dog. How do you say, well, look, this is how you've got to manage an introduction, for example?
I think certainly under strong or straightforward monitoring and supervision, you wouldn't just leave them to their own devices. I think it's important because now you're taking a strange dog onto another dog's home turf. That can often be a little bit objectionable, particularly if they're both adults as well. That can be problematic. I know when we go to my folks' place for dinner, little Molly will come along. So she's still a youngster, but her and Cooper get on famously. But they've been introduced gently with each other, even on neutral turf beforehand. Might be an idea to do something like that. Not necessarily getting your pets all riled up when somebody new arrives or with somebody else, because that excitement, it's all fun and games until someone gets hurt, kind of thing. So monkeys outside can also get dogs all riled up, and then they climb into each other. So I think monitoring and just taking it slow and gentle, or don't do it at all.
Yeah, try and avoid it.
But I mean, some of the cases will be unavoidable, and then put them in a separate part of the house, for example. So just even keep them completely separate so that you're not even close on getting some sort of altercation happening.
I don't think it's safe to feed them at the same time.
Oh, certainly.
Those kind of resources can...
Most dogs as well are also, they're so much, as cats are, they're very much creatures of habit and routine as well. So getting fed in a different place. Now,
it's competition.
A foreigner has come into your house and now you're guarding your food bowl. Everybody's around the braai and you're giving this piece, this one a little bit of something, and it doesn't take much to spark off an incident. So, unless they're obviously familiar with each other and then they get on like a house on fire, then that's absolutely fine. But I think introducing particularly adult dogs might be a little bit of a confrontation.
Yeah. So there is an incident, let's say, and fight wounds can be one little bite, or they can be quite extensive. How do you advise owners when you get the phone call and they say, my dog's been involved in a fight? Are these cases that you always recommend a clinical examination of?
So I think, obviously if it's like a little graze or something that it hasn't actually physically broken the skin necessarily, I think a veterinary appropriate disinfectant or something just to clean it or the likes of that is sufficient. Puncture wounds, they can actually sometimes be quite devastating. The iceberg effect, so you can see this little hole, but underneath it's absolutely shredded. So I do think you can get this big, massive pocket where you're going to get this huge either blood or tissue fluid accumulation, which is just a little petri dish waiting for an abscess or an infection to get set into. So I do think, and again, I'm all for people apologize or like, I'm so sorry I wasted your time coming in here because it's really not that serious. It's like, I would much rather you have done this than waiting 4 or 5 days and now you've got this big, massive abscess. We now have to sedate, we have to lance, drains, all the rest of that. Yeah, and then it's antibiotics, it's painkillers, it's, so generally with anything, the sooner you can potentially sort something out, that is the best time to do it. I would, you're not wasting anybody's time, so just come in and rather just get it checked out.
I mean, the greatest example is when we have a cat bite abscess. I think people don't appreciate they have a lot of bacteria in their mouths, and that penetration of a tooth, particularly a long canine tooth, into tissue can then seed that bacteria into the tissue. And that's why we get cat bite abscesses, because that may close over and fester and become...
But that's the thing with cat skin as well, because it's so elastic and I think in my experience it heals really nicely. You will get that little puncture wound. You might get a little white little dot or something and people think, that's nothing. And then the next thing, a couple of days later, you've got this big massive swelling, which is in an abscess forming. So then sometimes it might rupture, which is fine because then all of that muck comes out. But then the clients don't still then bring them in because now, it's ruptured, it'll be fine. That skin closes over again and you get that little nidus of infection and you get exactly the same thing happening again. So it is always advisable to get it flushed out, lanced and drained, sorted out.
You look at me, I look at you, I see the love in your eyes. I'm lost in
Health you can see, love you can feel. UltraPet, the science of love.
That iceberg effect that you're discussing, but we often get them where there are wounds, and one of the biggest concerns is if it communicates with the chest or the abdomen. Explain for the benefit of the listeners why we worry about those.
Oh, geez, yes. If you get for example, with the abdomen, if you get a herniation, so there's not a lot actually protecting. There's skin and then there's muscle and then you into your internal organs. So if there has been a severe penetrating wound by one of the canines or a laceration or something like that, it might not again necessarily break the skin, but then you get this bulging that comes out. So that means that your intestines, which are supposed to be inside, are now coming outside. The same with the chest. If you get a puncturing wound or something in there, you're going to get loss of the negative pressure in there. So there's going to be massive breathing issues, collapsed lung, that sort of thing. So those definitely need to be sorted out very, very quickly. And those aren't going to go away. They're not just going to spontaneously sort themselves out. You do need intervention for something like that.
Most definitely.
Yeah.
So, obviously we know the road traffic accidents or hit by cars or however you refer to in whatever country you're in. I remember, obviously qualifying in the UK and it was the RTAs, road traffic accidents. I got to South Africa, I was like...
I remember getting them, I was like, what is an
what
RTA?
Is RTA?
And they're like, oh, you're hit by a car.
HPC, wrong country. So however we define it, we also get a lot of traumatic incidents like fractures and things at this time of year, whether it's, people are out hiking or, the animals are sort of out and about, whether it's new environment and fall. How do owners best handle that if they are concerned that there may be a fracture, particularly in the point of dealing with it in situ and getting them into the vets?
Yeah. So I think the important thing to realize, and this is now generally with any sort of traumatic injury, is that those dogs, even the cats, they're not also going to be thinking straight. They are in a state of shock almost as well, and trauma. They're not going to be behaving correctly. So even if it is the friendliest dog, if you rush to them very, very quickly, there is potentially the likelihood that you yourself are going to get bitten or injured because they're just going to lash out. They are so worked up and flustered themselves. Yeah. So I think it's important if you are able to let them calm down. I mean, they're probably bless them. They're probably going to be screaming their heads off, but that also then starts to dissipate once then almost like the gravity of the situation sets in. And then you can get a better idea as to what's going on. So yes, if they're lame, they're not putting their full weight down on a particular limb. I would say, again, x-rays are the modality of choice for something like that. I mean, it might be very obvious that something is broken, other times not. And then, it's important then. And again, you would think that would be extremely painful. I was blown away 2 weeks ago. Again, I was with a little toy pom. that had fallen out of an owner's arms because it's a really little thing, young little thing. I was moving this leg around, palpating it, all the rest of it, and the little thing was just looking at me as if nothing was wrong. And I said, let's just err on the side of caution, because it had already had a previous injury to this particular leg. Took an x-ray. Both radius and ulnar were fractured. So the little one had to then go for surgery to get that sorted out. We saw the little one the other day just for a little bandage change. Fantastic. So just because they're not screaming in pain does not necessarily mean that there isn't actually a fracture or something there. And again, radiographs is the easiest modality to pick up something like that.
And obviously I went to the extreme, but the other thing that we see quite commonly, because people are more active and they're walking their dogs, they're throwing the ball, they're spending time in the garden, we see the ligament and tendon issues. And so I wanted to start with the fractures. People are like, what? But actually more commonly, we see soft tissue injury in our pets at this time of year. What is your advice generally on ball throwing and advising owners who have high-risk pets on the kind of activity that they should and should not be doing?
So certainly running in a straight line, so that means either up and down a fence after the monkeys, after the any motorbikes or something that are coming past, and it is turning on the spot and then running back in the same direction that they've just come from. So that is the major cause of the cranial cruciate ligament rupture. Same goes if you're throwing a ball, the dog's going to run, chase it, grab it, and then run back in the same direction. So I think anything in moderation. So that's always a good thing. It's not always possible to predict when the monkeys, for example, are going to be coming through your property. No. But if they are around, I think it's very important to try and then get your dogs inside so that they're not then running around or jumping up at the fence or the wall trying to get them to prevent then the injuries in those stifles or the knees as well. So that can often be quite a tricky thing to pick up on an x-ray. You can certainly do x-rays for something like that. But the cranial draw sign is pretty much, I think, in my experience, the way to go to get a definitive, yes, those tendons are a little bit lax or they've been completely severed. Yeah. And funny enough, I don't know what you find in your experience, that it's not necessarily a very painful condition for them.
No, it's more functional.
Yeah, so more like an instability sort of thing. So with a dog, they kind of wobble and they can feel that instability there. So then they will generally rather just lift up their leg and not walk on it. For the ladies, appreciate this. If you're walking on a 6-inch stiletto that's broken, you know that if you put your weight just right, you will still be able to weight bear. If not, you just rather take the shoe off. Similarly, the dog, if they're putting weight on it and they're feeling unstable, they'll just lift it up. So yes, some anti-inflammatories would have been something like that to start off with, but it will generally take more investigating to get a definitive diagnosis of that, and then that is generally a surgical procedure to correct something like that.
So you made mention of the monkeys. They're part of our flight wounds type thing, but we also see an increase incidence of pets coming across wildlife, whether it's they've gone for a walk in the gorge or an area that has this, but monkeys in particular cause major traumatic wounds.
All those teeth are like steak knives. They're very, very sharp, and they can do a lot of damage in a very short space of time. So thankfully, I found, with the dogs that have come through to us, people say, it was a monkey fight, but you can actually tell the difference between a physical monkey bite versus a dog bite because of monkeys. So again, just getting back, dogs, they get so riled up and they will actually start then fighting amongst themselves. So they can be absolute best friends, but they just get so riled up and so excited, all reason goes out the window, and then they can climb into each other. So they are often, yes, the monkey might be sitting up there in the tree, but it's not them doing the actual physical damage, it's the dogs that are sitting. And again, this sort of time of year, we're getting lots of baby monkeys. If one of them happens to fall onto the ground and then a dog is around that's going to then either come and investigate or worse, that troop is not going to sit idly by and just watch something happen. No. They will come down and try and protect, and that's when the real damage can get done. It's horrible. It can be a mess. You kind of like when you get presented with this dog and you're just like, okay, let's see how we can put this all back together again. It can be savage. And
I know that we touched on this before because we discussed bee stings and snake bites and whatnot, but this is also another thing that we often see acutely, like a traumatic event, is if dogs are bitten by snakes. What are some of the typical signs that you see, particularly because dogs will go outside and then they'll come back suddenly, maybe screaming or in a panic or behaving slightly differently. But what should owners look out for?
So I think it also just depends on the type of snake. We generally get the rhombic night adder here, which is not necessarily fatal, but you will tend to find localized swelling and bruising in that particular area. And the bruising tends to also migrate as well. So even though there might be localized bleeding on the neck or sort of like around the lip sort of thing, you will often find that over the course of the days, the bruising will actually start to gravitate down. So even though it's inside the body, it's still obeys the laws of gravity. So you might be lucky that you would actually see either one or two little puncture wounds, either on the lip, bottom lip, maybe the ear. It's not always possible to find that. So it can sometimes be a little bit of an investigation, or just seeing what sort of clinical signs present to you at the time, and then you treat them symptomatically and see what else might manifest itself.
Yeah, that supportive care is really beneficial, particularly if you don't know. You don't know what's bitten them, you don't know how it's going to progress, and how long ago necessarily even, if you come home from work and you discover your pet like that. So
sometimes you might be lucky that the dogs have killed the snake so that you can identify it. And usually if it might have happened some other time and you kind of like over half an hour and your dog is still alive, you kind of know that it's not a serious one, because that is literally the amount of time, even less, that you have if it's one of the real nasty. So like a puff adder, or a green or a black mamba, that I'm afraid, if that it's very rare, thankfully. But if something like that happens, there's very little that we're going to be able to do, unfortunately.
Porcupines.
Yes.
When last did you see a case like that?
It's been a while.
It's coming.
Because everything's more active. The evenings are longer, or the days are longer as well. They tend to, thankfully, be nocturnal. But again, if you're living on a conservancy or next to the gorge, you are likely to see them. So I don't think they're particularly aggressive. They are just an animal that is going to protect itself. But yes, we do have the odd one coming through that'll have a porcupine quill through its mouth or in the shoulders or something like that. Because if a dog has never experienced one before, instinctively they're going to try and maybe get there, and then they get a whole face full of porcupine quills. So again, depending on the severity, and they don't. I think there's a limit as to how deep they can go. I stand corrected for that, but the ones that I've seen have generally been quite shallow and haven't gone like into the abdomen, for example. Yes, they've gone into the muscle bodies, and that's going to be very, very uncomfortable. But it often can actually be quite tricky to get them out. Then requires sedation, because they're not just these beautiful little smooth things. They've got those little backward-facing barbs. You try and pull them out, and you're not necessarily going to get anywhere. And I think the bigger, the more entrenched they can actually then be. So it does then require some sedation, so that the animal's not then feeling any discomfort, and then you can do what you need to do and get all of those out. But it does happen.
Two things I want to cover before we lose the opportunity. One is we're talking about wildlife here. Crowned eagles. We've seen quite a few.
I know. So it tends to, as far as I understand, be the more juveniles that are practicing. And if you've got a little Yorkie or a little Scottish dog sunning themselves in the grass, they are not aware. They don't know to look up. They've got zero anti-predatory instinct or anything else like that. So, it is such an easy target. And it will tend to be the cats and the smaller breeds of dogs that it does happen to. Sure, again, it just depends on how fortunate or unfortunate the little pet is. We've had a couple that haven't been, again, which is why we tend to think it's the juveniles, because they might not have grabbed them correctly. So yes, you get the puncture wounds, but thankfully we're able to sort that out. The nasty ones is if it's obviously around the head and the chest. Those talons are massive.
Or the ones that were dropped.
Well, that's also the thing. So if they're wriggling around and frisky, then the bird will be like, well, this is a little bit too much effort, and it'll get dropped. So the crowned eagles would generally go for monkeys, as far as I know, as well. So monkeys are obviously, they're up in the trees. They're very much aware, because they are a potential prey animal. your little Yorkie, Maltese, Dachshund, and your cats. I mean, I don't think there's any size cat that's actually safe from something like that. So I think if you're living in a particular area that does have the crowned eagles, for example, I think it's very important to, and there's plenty of deterrents that you can use that is not going to be detrimental to your dogs or your cats or the crowned eagles. It's just going to dissuade them from doing something. One of our clients, their little Dachshund had been taken, managed to pull him through, absolutely fine, and he goes outside now. Whenever he does go outside, he wears a bright yellow jersey and hasn't been touched again. So that might be something. So as long as it's something bright and unnatural coloring, might dissuade the eagle from trying to do anything.
Okay.
I mean, trying to get a jersey on a cat is a different story, but at least for a dog, you can put them in a little jersey or something like that.
I was thinking about my chickens. I was thinking, how can I? Shame. Because they're also targeted.
I saw a thing, I think it was either on Instagram or Facebook, where they had these globes, these wire globes.
Like the hamster balls.
You put the chicken in, and they just roll around and doing the pecking thing, and nothing can get to them from the outside.
Clever.
So there you go. But yeah, shame it is. And then people my beloved little Fifi's just been taken, and then they get anti the bird, and it's just the bird's just following its instincts.
Absolutely.
So it is a bit of a love-hate relationship. But yeah, I think people are becoming more aware of it. And they will then generally be outside with the cats are a little bit more tricky because they tend to be a little more independent. But if your little dog is outside, even if you are there as a presence, I think the likelihood of that eagle coming down is dramatically reduced, if not completely dissuaded. At least you can make a loud
noise or a big show.
Yeah.
So before I lose the opportunity, the one thing I wanted us to talk about, because we are based in KZN, coastal town, a lot of people enjoy fishing. They go to the lakes, they go to the beach, they walk their dogs. And I've had a couple of cases where dogs have got hold of fishing line. They've swallowed the remnants of whatever's been left on that
with
hook.
the hook on it as well.
And the hooks on it. And the child grabbed the line. What do you do? What do you not do in these cases? Because obviously we need to be removing these generally either with a scope or surgically. But the trauma that's done with owners with their best intention, trying to help.
Yeah.
Can you take us through that?
Well, they just see a piece of gut sticking out, or they see the dog actually physically going, and you're not going to actually know if there is a hook attached to that little piece of sardine or whatever that they were using. But I mean, again, getting back to the dogs being revolting, they will go for the stinkiest, smelliest revolting thing. So if they find this on the beach, before you know it, it's down the hatch. So the worst thing you can do is grab that piece of gut and pull it. So my first job, I worked at an emergency vet down in Cape Town. And exactly that scenario, it was shame. It was a little 3 or 4 year old that was running next to the spaniel, went and ate this thing, and this little kid didn't know that there was a hook involved, neither did the owners. And this little kid grabbed and pulled. The dog yelped, didn't seem to be anything wrong. By the time it got through to us, it was an absolute disaster because it had not only perforated the esophagus, but it had traumatized the lung tissue as well. So that's how severe. I mean, it was a monster hook. So for an instance like that, there was no time to get to a specialist referral center that's got all the super, super specialized equipment to deal with something like that. Yeah. So then the kindest thing was to call it. Unfortunately, we had to put that dog down. But the worst thing you can do is grab and pull. So as horrific as it sounds, if it's in the stomach, we can still do something about that, because the likelihood of it then having traumatized anything, yes, you might have got a few abrasions or catching, depending on the angle at which the hook went in. But if there's gut or fishing line attached to it, do not pull it out. So even if they're walking around with a piece of gut, leave it. Don't touch it. And again, because that hook is metal, x-rays will beautifully show it up, and then we would be able to take then the necessary steps to then extract that hook.
Yeah. So keep some of it. If it's long, cut it a bit shorter.
Oh, certainly, yeah. So you're not going to then run the risk of
standing
entangling.
on it.
You're pulling it down themselves.
Too visual when it comes to this sort of thing.
But I would then literally pick them up off the floor and, depending on the size of the dog as well, and get them into a facility as quickly as possible.
How often have you seen them just in the mouth? Because I've seen a few cases where they just hook.
See, so that's a different story, because if you see it, then if it's just even if it's through the tongue, or through the side of the cheek or the lip or something like that, I mean, that's then a general, it's a quick, even a sedation or something like that, yeah. So, but again, because, you don't know what state the hook was in or what might have been attached to the hook, it is always a good idea to get it checked out, because this dirty, rotten fish, rusty hook that's now gone through the lip, I think it'll be much better to have that checked out.
Then my parting question for you on this, because I think then we've covered most of the traumatic issues. Sticks. So we see a lot of people wanting to interact, whether it's ball throwing or no, now you're not allowed to throw a ball. And like I'm saying, throwing sticks, oh no, now you're not allowed to. I actually feel sorry for the backwards and forwards in terms of the advice that's given. But let's talk about some of the stick injuries.
So I have had, funny enough, I was in the UK working at the time, and the dog came in and they said they had been playing with a stick and throwing it in the park, and as the stick had landed, it landed one side in because it was a bit of a sharp end, and the dog ran after it but wasn't anticipating that it was going to get stuck in the ground that early on.
Yeah.
And then literally then went down to grab it and anticipating that it was going to be transverse, and it was sticking right up and it went straight into the back of the throat and had then broken off. So then the dog was trying to paw at its mouth and everything else. So they couldn't actually see the extent of what had happened. It was probably about 6-7 centimeters worth of stick that thankfully had missed everything vital and had just gone through into the soft palate at the back of the throat. Obviously, we kept that dog over for a couple of days just to make sure that there was nothing. So that is the problem of spiking in the back of the throat if it lands incorrectly. Another one across very famously across the top of the mouth, and then you'll see the dogs are pawing, and you can actually then see it physically caught, and it's generally right at the back with the molars and it just gets pegged perfectly in there. So the dog has literally gone and bitten it, and then the piece is then broken off and then gets stuck on the roof of the mouth as well. So again, depending on the temperament of the dog, you can actually do it without sedation. If you're fortunate enough, you've got your specialized clamps that go in and pop it out, and that's usually all it takes. If they are getting a little bit fractious, then a sedation, and then we just pop it out. And usually for something like that, there's not a lot of trauma, so it doesn't necessarily require any treatment. If it looks like there's a bit of trauma, then a painkiller and anti-inflammatory should be more than sufficient. If they swallow something like that is a bit of a different story as well, because again, if it's a sharp piece of wood,
skewers. Hey.
Oh, yeah. Kebabs and societies and stuff like that. So that again, wood is not the best substance to be picked up on an x-ray. But then again, you could probably find little telltale signs of something being there. So, yeah, again, we're implicating the braais a lot at the moment. Don't bra, just don't bra, because with all the fat and it's just, no, don't. It's the corn cobs and everything else. So, yeah, but those sharp kebab society sticks are another prime example. And even again, you've thrown them away. The dogs can rummage in the garbage or in that bag. So get the mealie cobs and the corn cobs, and then those sharp sticks. So I think there's plenty of other throwable options to interact with your pet. So I would encourage that rather than a stick. Or if you're going to throw a stick, it needs to be thrown so far in front of your dog that it's landed and is stationary. Sometimes not even worth the effort, because I think the risks of injury probably outweigh the fun that it's intended for.
Thank you for taking the time to discuss all these risks. Hopefully we've done a little summary for some of the, rather than approaching it from specific cases, just some of the causes of some of the cases we see during this time of year. Obviously we want to just have fewer pets, have these dreadful very costly and very emotionally intensive conditions. So
and I think, so we're not making these stories up either. It's not urban legends. No. It literally does happen.
Yeah.
So it's not to add pizzazz or anything else. It is literally
case examples.
Yeah. That you and I have both seen, countless other vets would have seen as well. So
and multiple.
Yeah.
These things are common
sad.
this time.
Yeah.
So if we can help a few people, just even if it's recognizing what is going on, so that they take some immediate action, then.
And I mean, also nowadays as well, it's so easy to either send a message or take a video or send a photo, so that again we can then say,
serious, not serious.
I don't think it's so that bad. So I mean, there's a lot of triage that can happen without actually physically. And nowadays, because you can actually physically see a potential issue, it does make it a lot easier. So if there's a veterinary practice that utilizes that sort of thing, then I'd say use it.
Yeah.
And again, stress. We are just a phone call away. Phone us. We're here to help. With anything.
Thank you.
Okay.
Thanks for a great
conversation. Thank you for having me back again.
It's been such a pleasure.
Thank you.
Thanks. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hypo what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.